You don't have to buy so much. Take it easy. Just relax. People are going in and they're buying more. Relax. We're doing great. It all will pass.
President Trump talking about what's on a lot of people's minds: shortages of essentials like food and toilet paper. People are flocking to the grocery stores and big box retailers, and they're snapping up everything in sight and cleaning out many store shelves. But then you already knew that, didn't you? Grocery chains and food producers are saying there's plenty of food and short-term disruptions shouldn't turn into long-term problems. As we know, life has been upended for just about everyone in the country. And now President Trump is trying to coordinate the effort across all 50 states. He held a conference call with all the governors, but the New York Times reports that there were some rocky moments. Here's a quote: respirators, ventilators, all of the equipment, try getting it yourselves. This is what Mr. Trump told the governors during the conference call, a recording of which was shared with the New York Times. He continues, we will be backing you, but try getting it yourselves. Point of sales, much better, much more direct if you can get it yourself. The Times is also reporting that many of the governors were shocked after the president said that despite that, take a listen to what Donald Trump said soon after the meeting.
We had a great talk with the governors today. I think it was a really great talk. There's a tremendous coordination. There's a tremendous spirit that we have together with the governors. And that's pretty much, for the most part, bipartisan.
Craig Fugate was FEMA administrator from 2008 until early 2017, and he joins us now. Craig, can't thank you enough for spending a little bit of time with us today.
My pleasure.
Well, you know, it's fascinating. We are having so many conversations and so many efforts underway to keep people from leaving their homes, to stay out of these crowds, everything that we keep hearing about. But you know what nobody seems to be talking about? Now that we've got people in their homes, how do we feed them? How do we take care of them? What do we do? Now, you experienced this before when you were running the relief for the swine flu epidemic. What do we do to make sure that these people, particularly seniors, are being taken care of?
Well, again, what we are telling people, stay home, but not everybody can stay home. People do have to go to work, particularly those in the supply chains like grocery stores, drugstores. But you're seeing those stores going with reduced hours. They're doing more cleaning. They're restocking. So the system is actually doing what it's supposed to do. Those that can stay home, stay home. Those that have to go to work are doing everything to keep them safe. And this is why it's really important that our safety nets have to stay up. We just can't shut everything down. Everything from emergency services to Meals on Wheels and checking on seniors. All these things need to be going on, but with a degree of caution, making sure everybody's doing the basics of washing your hand and wiping stuff down. And the more of us that can stay home and work from home means that we're providing better safety for the people that have to work to keep our systems up and running.
Well, I'm very pleased that you brought up Meals on Wheels. We were actually talking about it earlier. Here's an organization that exists to feed people on a regular basis. Is there anybody who could be more critical at a time like this? But now Meals on Wheels, to the extent that they're going to be able to do it, because you're going to have a lot more people not able to get out of their homes, can they possibly handle this increase in need? And then I think about people, particularly seniors. We all know that seniors are the highest at-risk group. How are they going to get their drugs, the things that they really need on a daily basis?
Well, you're seeing an increased utilization of delivery services. And again, for a lot of seniors who can take advantage of that, order their medications online, get them delivered, order their meals online, get them delivered. But for those that can't, that will allow the system to focus on the ones that can't. And again, every local jurisdiction, all the state emergency operations centers are all gearing up. I think part of this is looking at the infection and managing the coronavirus itself. But now people are starting to look at the secondary level effects of how do we continue to support our communities, keep enough critical systems up and running to take care of our most vulnerable populations.
So we understand, people like you in particular, understand how the system can work. My question is, are we really systemically set up at this point for the kind of numbers we're going to talk about? It's great in theory that we have some ability to do some of these things, but as you look around and knowing what the numbers are going to be, they're obviously going to be, unfortunately, a great deal more than what you confronted with swine flu. Do we have a system in place that's going to be able to really get it done?
Well, the short answer is no. This is why it's so critical to flatten this curve. If we have the sharp peaks or we see what happened in Italy and the United States, it will overwhelm the systems, and then the losses, both from loss of life, but the impacts to the communities are going to be much greater. The whole plan, including when we were working on H1N1 to now on coronavirus, is to slow this down so it's manageable. That's why social distancing isn't as much about keeping you safe, it's about keeping the community safe. The more people that are staying home, the better chance they have of flattening this curve out and keeping the numbers manageable. But if we're not able to do that, if we cannot flatten this out, it will overwhelm the system. There are finite resources available. And again, when you think about disasters, we have disasters in one place. Coronavirus is hitting all of the states and territories simultaneously. So we have to do everything we can to flatten this curve to give the rest of the system a chance to keep working and meeting those immediate needs and dealing with people sick, but also people that are shut-ins and going to need more help to get through this period.
Craig, you are somebody who has experienced this before, albeit on a smaller level. I think the message is now pretty much getting out there about the importance of flattening the curve. We've all come to understand what that means. We all understand that they didn't really do it in Italy. They saw it skyrocket. It overwhelms the healthcare system. I think Americans are pretty tuned into this. My question to you, however, is did we get started in time? And even if we didn't get started in time, what's past being past, are we still in a situation where if Americans of all ages will take this advice seriously about social distancing, we can still flatten that curve?
Yes, we can. I think we lost the ability to contain it, and because we don't have enough testing to rule out the widespread social distancing steps governors have taken to limit gatherings, closing bars and restaurants. These are all very draconian measures to flatten this curve out, but it's what we need to do right now. We're seeing too many cases occurring that there's not containment on this, and we don't have enough testing yet. We're getting there, but we don't have enough testing to rule quickly out people that may have it or may not have it. So what we can do is those of us that can stay home, and allow the people that do have to go to work. And it's not always the healthcare workers and the emergency services. It's the people stocking grocery stores, the people working at the pharmacies, people making deliveries. If we can keep as many people home and allow them to go in and be able to work without a lot of us carrying this virus around, it gives us a chance to flatten the curve out.
Let me ask you this. What I'm seeing from people, they're starting to gain a fair amount of confidence in their state officials. We've seen governors who really seem to be on top of it, mayors. There is some concern, as you know, about the federal response. How important is it that the federal government and the state governments be able to work together? How critical is that in your view?
Well, it will be the success or the failure of this. And I think we're seeing a lot of what I call the pundits out there talking. The people that are really important are those middle-level managers, the people behind the scenes that are not out doing press conferences, that work daily together, from the CDC working with state and local public health officials to FEMA working with their counterparts in state emergency operations centers. And those systems are working to bring everything together. When we looked at this, we came to the conclusion that state and local government and the federal government operating separately won't work in big disasters. We have to work as a team. So a lot of these folks that they're not on the press conferences, they're behind the scenes getting stuff done, are what's going to be key to the success of supporting the governors and their role of leading this response in their state and local governments.
Well, that is encouraging, Craig. I hope those teams are busy at work. We really appreciate you spending some time with us tonight. Craig Fugate, prior FEMA administrator, worked in the Obama administration from 2008 until early 2017. Craig, again, thanks so much for your input and your insight.
Thanks for having me.
Up next, stocks are diving, markets are panicking, and now the Federal Reserve and Congress are trying to respond. After the break, we'll show you what they're doing and discuss it with a former Democratic congressman.